medicine. This time, we focus on imaging planning and some suggestions how to reduce radiation burden. This slide is known to you from the previous webinar. Now, the green labelings indicate all tumor entities in which nuclear medicine is of importance. As you can see, more than half of all pediatric oncology patients may profit from nuclear medicine. Nuclear medicine can be relevant for tumor staging, selection of biopsy sites, risk stratification, monitoring of therapeutic response, and radiotherapy planning. Moreover, especially in thyroid carcinoma, but also in neuroblastoma, radionuclide therapies can be essential in addition to nuclear medicine diagnostics. Before any nuclear medicine scan, make sure that you have all relevant information you need to adequately perform the investigation and to correctly interpret the images with regard to the clinical context. Be communicative. Get in touch with the referring physician in order to receive the necessary information displayed here. Be aware of potential risks you expose the young patient to when performing nuclear medicine scans. One risk is a potential neurotoxicity related to frequent need for sedation or general anesthesia in children. Again, it is all about communication. And again, the referring clinician is the appropriate person to determine if the child will require sedation or an anesthesia. If sedation or anesthesia is needed, the pediatric anesthetist is to be contacted to arrange a time for evaluation of the child for the procedure. Furthermore, it is important to keep in mind that children and adolescents are more vulnerable to the effects of radiation than adults. This holds especially true for pediatric oncology patients who have to undergo repeated scans, what results in a higher cumulative radiation dose. Note that organs and soft tissues in this age group are more radiosensitive, owing to a faster rate of cell division and the comparatively longer post-exposure life expectancy in which to exhibit adverse radiation effects. In general, girls are at a much higher risk for radiation-induced cancer since they have a higher incidence for breast cancer, what is especially true for those girls who are exposed to radiation during breast development in adolescence. And here are several suggestions how to reduce radiation dose to a necessary minimum. First, avoid unnecessary examinations. Unfortunately, the number of unnecessary pediatric imaging studies performed is higher than expected, owing to a variety of factors including physicians' concern of malpractice, lack of physician awareness of imaging guidelines, financial incentives to order more studies, and also parental pressure. As a principle, choosing an imaging study should be based on the expectation that the benefit of obtaining the study outweighs the potential risks of performing it. Therefore, get in touch with the referring pediatric oncologist to discuss the benefits and limitations of the requested examination. Second, calculate the appropriate dose of radiotracer. In order to define the upper limit of PET radiotracer dosages, or the appropriate dosage for SPECT tracer, I recommend you the EANM dosage calculator, which is a reliable, easily accessible, and free tool. Third, reduce CT dose. Keep in mind that 4 main factors affect the CT dose. These are tube current time product, or milliampere second, beam energy, or peak kilovoltage, helical pitch, and axial collimation. To child-size CT protocols compared with adult techniques, one needs to reduce CT imaging parameter dosages by decreasing milliampere second, reducing peak kilovoltage, and increasing helical pitch. For children, it is particularly important to choose the appropriate scan field of view, use dose modulation techniques, and avoid, if possible, multi-phase imaging. Fourth, reduce the extent of areas imaged. That means determine in select situations if whole body or skull-based to thighs imaging only is necessary. To sum up, you have learned that interdisciplinary communication is particularly important before performing scans in pediatric oncology patients. Furthermore, how important it is to avoid unnecessary radiation burden in this patient group, and how to effectively reduce the required radiation. Thank you very much for listening.